Well, good afternoon, everyone. My name is Teresa Branson. I'm the Deputy Health Officer at the Kent County Health Department. I want to thank everyone for taking time out of your busy schedules. We have been working over the past several months in meeting with different community groups, and this is one of the items that we've really heard strongly and clearly from community with the interest of having a train the trainer. So without further ado, I want to turn it over to two of my other colleagues that are joining us today to give their introduction, and then I'll provide an overview of what we hope to accomplish today and go over some guidelines. So Dr. Bora and Dr. London.
Hello, everyone. My name is Nirali Bora. I'm a family physician and the medical director of the health department, and I look forward to having a chance to talk with you today.
Hey, good afternoon, everyone. I'm Adam London. I'm the director of the Kent County Health Department, and also looking forward to having a good conversation with you about COVID, and just appreciate all that you are doing to help us be communicative and helping all of our community through this difficult time. So much appreciated.
Thank you. And as you can see on the slide here, if you have any questions, you can email those questions to covid@kentcountymi.gov. We also want to encourage you throughout the presentations to post your questions in the chat. We'll be taking a look at those. And then I just wanted to go over a few guidelines, and it's great to see a lot of familiar faces on the call. And again, thank you for your partnership throughout this COVID pandemic. We encourage you, if you have some needs that you need to tend to during the meeting, to please take care of those. And if we can move to the slide on guidelines, I'd greatly appreciate it. So these aren't really rules, but just kind of more guidelines and expectations for our time together today. Please, we ask again, we know everyone is very busy and just respect everyone's time, but just ask for everyone to be present and respectful and candid. We're here to support, we're here to answer questions, and we're here to provide, hopefully, a great overview that you can take into the community and use as you see fit. Honor differences, and make sure that we're making room for people to bring those questions forward. We'll have time after each presentation for questions and time at the end as well. So if you're someone who's normally stepping up, there may be some individuals on the call today who may not be as comfortable stepping up. So again, encourage people to use the chat, or just recognizing we want to give time for everyone to get their questions answered. Putting ideas in the middle. So if you have ideas on how we can best reach people, please put those forward. And then use both end thinking. We're in situations right now where we hear a lot of different perspectives from community, and we're doing our best to meet questions with fact, especially as we go into more and more vaccine across our community and getting that administered as quickly as we can. Just ask for everyone's patience and understanding, and just keep on bringing your questions forward, and really just encouraging everyone today to stay open as much as you can to really hear many questions that we've heard. And so some information may be repeat, other information will be things that are questions that you're hearing all the time in the community. And our goal is just making sure everyone is equipped with information, tools, and resources you need to be successful in the community and in your roles. Again, we're having people join by phone and computer, so we'll do our best to make sure we hear those who may be on the phone. If you're able to, please turn your video cameras on just so we can see who's in the room here. We ask that you please mute if you're not speaking. And again, we do have a break built into the agenda, but when we get to that point, if everyone feels like we're kind of at a good space, we probably can keep going. But just recognizing if you need to take care of something throughout our time together, please do so. Thank you. So the overall goals for the Train the Trainer, we want to continue to share information within your networks and about the COVID-19 virus and the COVID-19 vaccine. We're asking your help and support, and in response to what we've heard from community, to assist your networks in getting people registered for a vaccine on at vaccinatewestmichigan.com. You'll see us put this in the chat, and we'll continue to focus on this website because this is where we're concentrating a lot of resources. So overall, again, our goals were to provide education and orientation on vaccine and our overall on COVID. And outside of that, to equip people with tools and resources and information. The information we share today, this is for your personal use to equip you as community connectors, as community organizations serving community. We are recording this session. We recognize that we're not able to reach everybody today, but our marketing communications manager and public sector consultants will break this down into different videos that will also be shared that you can use with your constituents. So I'll turn it over at this time to Justin Foss with Public Sector Consultants, who's joining us on the call today. Justin?
Hey, good afternoon, everyone, and thank you again for joining. At this point, we'd just like to take a moment to hear from you what your expectations for the training are, and specifically what you hope to get out of training for outreach to the community on novel coronavirus vaccination. So if you care to, either unmute yourselves and share a thought, or you can type into the chat box as well. Okay. Brittany?
Yeah, so one thing that might be nice, if we had some ways to talk to people, I guess, who are leery about getting the vaccine, I don't know how to phrase it exactly, but like incentives of why it's a good idea for them to get it, besides like the obvious, because if they already like don't want to get it, like what are the expectations after they're vaccinated? Like, is like, oh, you don't have to quarantine if you're like in contact with someone, or like, are there like certain incentives that we could kind of tell them about that might sway them, I guess?
Great thoughts, Brittany. Thank you. Other expectations or questions for the session? All right, hearing none at the moment, just know that we will have 5 minutes of Q&A after each module. So we would welcome your continued thoughts and questions at that point as well. And with that, I will hand things off to Dr. Bora.
All right, well, thanks everyone. I'm just gonna start with some basics right now. I'm just going to talk a little bit about, in just very simple terms, about viruses, what viruses are. And if you have questions, want more detail, feel free to ask. So basically, and I know that most of you know this, so just bear with me because I want to make sure that everyone's on the same page. We all come from very different backgrounds, and I want to make sure that everyone has a similar general understanding. So viruses are very small germs that cause disease. They're made up of genetic material that are chemicals that are inside of cells that give instructions for the cell for how to live and work, like DNA or RNA. And this is enclosed in a coat of protein. So viruses, unlike bacteria, they don't have any way to reproduce themselves. So bacteria are a different type of germ that can also cause diseases. So viruses need something to help them reproduce. And what they use is living organisms, so people and animals. So viruses enter cells in our bodies and use the chemicals inside those cells to help them multiply. This process can damage or destroy the cells that become infected with the virus. Viruses are extremely common. And because they don't have the same ingredients as bacteria, they can't be killed by antibiotics. Only certain antiviral medications can help attack against viruses, or vaccines can lessen the impact of viruses. So some examples of viruses that you've heard of are AIDS. So HIV is a virus that causes AIDS, COVID-19, measles, and smallpox. So most viruses are contagious, and that means they can spread from person to person in a variety of different ways. This can be through, gastrointestinal viruses spread in certain ways. Respiratory viruses can spread through coughing, through sneezing, Some viruses can be spread through eating or drinking certain things, not the coronavirus, but other viruses can be. Sometimes viruses go through mosquitoes. There are different ways that people can get different kinds of viruses. Some other common examples of contagious viral diseases include things like the flu, the common cold, herpes, chickenpox, hepatitis, Ebola, polio, rabies. So those are some other ones. So as you can see that they're all very different kinds of illnesses and diseases that they can create. So some of these viral illnesses like the common cold or sometimes a stomach bug, they're minor and they go away on their own in just a few days. The body takes care of it with its own immune system. But some other viruses are more serious. Viruses like HIV, we don't have a cure for. We have medicines to help keep it from replicating too much, but we don't have a cure for the virus itself. So unlike bacterial infections, which I said, viruses cannot be cured by antibiotics. Instead, the treatment usually is on helping the body stay strong, helping the body's immune system itself get rid of the virus. This means that the person needs to rest, drink fluids, and sometimes need medicine or other things to help them recover. So where do viruses come from? This is actually a really good question that we don't really know the answer to. So viruses are germs that might have come from small pieces of genetic material that learned how to move between cells to reproduce. So we don't really know, but we know that they can feed off and live on a variety of living things, plants, animals, insects, humans, a lot of different things. They keep changing over time. And what we do know is that they're very complicated. They change with time and that we keep learning new things about new viruses. I'll come back to a little bit more about a virus when we talk about vaccines. I am done with that piece.
Excellent. At this point, we'd like to entertain some questions for Dr. Bora from participants. And again, please feel free to either type your questions into the chat box or unmute yourself and voice those questions directly. All right, hearing none, we will continue on. And hand things off, I believe, to Dr. London.
All right, thanks for the handoff. And good afternoon again, everyone. Let's talk a bit about COVID-19, the illness that is caused by this nasty virus that Dr. Bora described. So what is COVID-19? COVID-19, COVID, it's actually an acronym. It stands for coronavirus, that's the COV, infectious disease. COVID, and then 19 being the year, 2019, that it was first observed. So when you hear COVID-19, that's the origin of that name, coronavirus infectious disease for 2019. The illness itself is somewhat unique to us because normally we have a pretty well-defined set of symptoms which we can pretty closely align with an infection. With COVID, what we first observed was fever, coughing, difficulty breathing, nausea. These sorts of symptoms were first associated with COVID-19. Since then, we've learned a lot about it, and it has this huge variety of symptoms, including things like losing your sense of smell or taste, vomiting, diarrhea, really running the gamut of symptoms, which can make it very difficult to identify for the person at home. That's why testing is so important. If you have someone who is feeling sick, especially fever, it is good to get tested. And there are many testing locations available, though those are at no cost to the individual. And where a person can get tested is listed on accesskent.com. COVID-19 is not the first coronavirus illness that humans have been exposed to. We've actually had 4 other types of coronavirus illnesses that have been with us for a long time. Because they've been with us for a long time, we have developed some immunity to them, some relationship with them, so that our reaction to them is not as severe as our reaction to COVID-19 or to this particular coronavirus has been. What's the part of the reason for that is because this is novel. And you may have heard that word novel before, meaning it's new to us. This virus is new to human beings in this past year and a half. And because it's new to us, we have no immunity to it. We're all vulnerable to it, which makes its spread especially worrisome and the symptoms especially severe in many cases. How is it transmitted? Well, we've heard a bit about the virus itself and that the virus needs to have a fresh living host organism in order to make more copies of itself. It can't reproduce by itself. And so it's looking for a new host all the time. In this case, the most common way it does that is through inhalation, and people cough as they talk, bits of aerosolized saliva or droplets of saliva carrying the virus particle are ejected. Those can be inhaled by others. They can also land on mucous membranes like the eye or in the sinus cavity. They can also be picked up by people's hands as they're touching surfaces that have been contaminated, and those can be brought to the eyes, nose, mouth. And so that's why it's very important that we talk about wearing a mask, because the facial covering, while it's not 100% effective at reducing the passage of every single virus particle, it is very effective at reducing the spread of those aerosolized droplets of saliva and those droplets that are ejected as people talk, okay? And so if we're containing those in the mask, those droplets of moisture are carrying most of the virus. We're stopping the virus with the droplets of moisture. That's very important. It's also why we talk about the importance of hand washing, because we want to make sure that any virus that does get on surfaces, that we're killing that before we touch our face. So our statistics across the board, whether it's transmission, death disparity, have been changing throughout the course of the pandemic. Last spring, we saw what we thought of as an initial wave. And remember, those were the days of let's flatten the curve. And that was so concerning to us because that was the moment that this novel virus arrived in our community. And we knew that if it got out of control early on, we would overwhelm the hospitals and many people would be harmed. Thankfully, the community, and thanks to everyone here and so many others who made it somewhat difficult for this virus to spread, so it couldn't really take off as quickly as it would have liked, we've been able to flatten that curve over the course of last summer. As we got into the fall, those colder conditions are ideal. People come inside, they shut their doors, their windows, they're in tighter proximity. That's an ideal setting for a virus, especially a virus like this that spreads in the air and in proximity with people. So that's where we saw a huge spike in cases during the holidays at the end of last year, where we saw almost 800 new cases every day. And we were seeing about 10 deaths every day. Thankfully, those numbers have come down. Now we're seeing about 70 to 80 new cases per day and 1 death per day. Still far too much. And we want to get through this as quickly as possible, but those numbers have come down, and they've come down because of everyone's good work together. There has been disparity in those numbers, especially early on. We saw that people of color and people that had less socioeconomic status and less ability to access resources suffered more than others. We saw that when those people were hospitalized, they often were in a worse condition than other people in the community. That's not because, there's no reason to think that that's because persons of color are any more genetically susceptible to this virus. And certainly the virus isn't hunting those people down, but it really comes back to what we call the social determinants of health. When we have people that are living in closer proximity, maybe in housing that's not as great as they'd like, when we have people who are part of that essential critical infrastructure workforce who have to go to work every day to keep the food supply going, and they have to keep the services in the community going, those are all exposure points that put people at higher risk. We have seen that disparity ease quite a bit over the course of the last year, but still disparities exist. And that's why getting this vaccine rolled out and paying particular attention to what we call social vulnerability is important. And looking at zip codes where people have had a higher rate of illness and the disease has been most damaging is very important to us. You're also hearing a lot about variants right now in the news, the UK variant and the South African variant, and now a California variant. You'll probably hear a lot more about variants in the future. But what you need to know is that it's not a surprise to us that this particular virus mutates. That's what viruses do, especially when they're first exposed to a new population like humans. And this particular virus is what we call an RNA virus. Its genetics is a single strand code of RNA as opposed to the double strand code that we call DNA that other viruses, bacteria, and other organisms have. That single strand makes it more susceptible to mutation because it doesn't have the sort of spell check with its code happening as much as DNA does. As these variants develop, they may each have a slightly different profile in the types of symptoms or in their contagiousness, if you will. But the thing you need to know about these is so far we have seen that the vaccines that have been produced are all very effective against them. And the prevention messages that we've been sharing, wearing a facial covering, avoid social gatherings, hand washing, all of those are a very effective way to protect against all of these variants. Now, this current pandemic differs from past pandemics in a lot of different ways, but I think the most important ways are that we have technology and information sharing now that was not available in the past. You know, we think of the influenza epidemic of 1918, and they didn't have opportunities like this one right here for us to sit down and to talk to all of you. They didn't have the same opportunity to learn, to share information, and to develop new technology like vaccine. Of course, they didn't have vaccine at all in 1918, not really. And the fact that we've been able to develop a vaccine this quickly is really remarkable. So those are a few ways that this current pandemic is different. Another way is that it's been politicized, unfortunately, in the past year. And that's something that we're all trying to get around and stick to the science and the facts about what COVID is and how to slow it down in our community. And I'll stop there for any questions.
Thank you, Dr. London. And at this time, again, we would just welcome any questions that participants have for Dr. London. I will share one that we have received about RNA, and this may be for Dr. Bora later on in the presentation as well, but whether or not RNA in the vaccine can change one's own DNA.
Dr. Bora, you want to go ahead and take that?
Sure, I can do that one. So no, the way that this mRNA vaccine works, there is absolutely no way that that RNA can affect the DNA. And I won't go into the full details, but just basically, I think this helps me understand it, is that if you have a picture of a cell, the DNA is inside the nucleus. There's a tiny little section inside the cell that is surrounded by another coating that protects that DNA. When the mRNA vaccine, when that goes into the cell, it stays in the fluid surrounding that nucleus. That never crosses into that nucleus to actually even affect the DNA. What happens is that little synthetic recipe that's injected into the body that goes into the cell, that stays in that fluid surrounding there, and that's where it starts making that protein. That's the protein that your body's immune system will eventually recognize. And after a day or two, that mRNA recipe, that's going to break down and go away on its own. So it never actually ever interacts with DNA. There's no chance for it to work. The body doesn't work that way either. That kind of would be going backwards in the sequence of the body. So there's no chance that it would have any impact on the DNA of your own body.
Great, thank you, Dr. Bora. And we have several questions in the chat as well. We'll take them from the top. The first is whether there are, and pardon me, what the severe warning signs for COVID-19 are.
So the interesting thing about this coronavirus, is that it affects people in so many different ways. Some people, the main things to really watch out for though, are someone who has a fever and difficulty breathing. Those would be the main concerns that I would recommend someone go seek urgent care. Not urgent care, but go seek care urgently. If someone is feeling lightheaded, feeling like they're dizzy, that they're going to pass out, those are other reasons. And they think they have other symptoms that it might be consistent. That would be another reason to call your doctor, get seen. But anything that would make you think, this is not right, I feel really sick, never hesitate to call your doctor or go to the ER. I trust people to know when their bodies are sick enough to go seek care. Some people just have vomiting. Some people have diarrhea. Some people, it's all over the place what the symptoms are. So anything that is worrisome, I would recommend to get seen.
Yeah, and that call is an important part of that advice. And as people ask you what they should do if they have some of those symptoms, we don't recommend that people just show up at their doctor's office. Having them call first and talk to someone there is important so that we can also make the doctor's offices as low risk as possible.
Many doctor's offices right now will have separate places where they see people who have symptoms and certain offices where they see people who don't have symptoms. And so that helps them know which is the best place for you to be seen. If you think it's more severe though, just go to the ER. That's always okay to do.
Excellent. Thank you, doctors. We have questions here about wearing 2 face masks. Should we wear 2 face masks? And a question about whether pregnant women are advised to get the coronavirus vaccine.
So I can take the face mask one, and then Dr. Bohr, you want to take the pregnancy one? Wearing a second face mask does slightly improve or frustrate the virus from spreading. There have been studies that show that the improvement is from about an 86% reduction in transmission to about 93%. So wearing a second face mask does make it a little bit more difficult for that virus to spread when you're in proximity to other people. But the thing that's really important there is, number one, just make sure you're wearing a quality face mask that has a decent fit around the nose and around the face. It seems as though the reason that a second face mask helps somewhat is that second face mask can put some pressure around, especially around the nose, in order to prevent air from freely flowing through some of those gaps. So if you have a face mask that has a nice, firm, snug fit around your nose and your mouth, that should be sufficient. If you don't, then you might want to wear a second face mask in order to give it some support. But certainly there is no benefit to the third or fourth. We want to be careful about that. Some people have interpreted this to mean that more is better, and they stack the face masks on, and that can be harmful. So please don't add more face masks to that. That's not going to be helpful. Dr. Bohr?
Yeah, so for the question about pregnant women, so I think this should always be a decision each woman makes independently. You're welcome to talk to your doctor about it. In general, though, we know that the risk of COVID-19, so women who are pregnant and get COVID-19 have more serious outcomes than women who are not pregnant. So being pregnant makes it more likely that someone is going to have worse reaction to the coronavirus and become more ill. For that reason, pregnant women are at higher risk of illness. That said, in all studies that are done on drugs and on vaccines, pregnant women are usually not included in these trials because the risk is unknown. So we don't have great information from the data. However, there are women who did get pregnant during the trials and did well. Also, looking at the biology of how this vaccine works, because it doesn't stay in the body very long, it is broken down quickly in the cell. There's no biologically clear way why that would be a harm for the pregnant woman or for the fetus. But because we don't have that clear answer, what that looks like, we would recommend people talk to their doctors to have that discussion more in depth. Pregnant women who are at high risk of being exposed, healthcare workers, anyone else, it probably would be safer for those people. It'd be less risk of getting the coronavirus if they were to get immunized. So many healthcare workers who are pregnant did choose to get the vaccine. There is no advice for them not to get vaccinated. It's just because of that limited data that we do recommend people talk to their doctors. The same goes for women who are breastfeeding. There is no biological link necessarily to how that would cause harm for the pregnant women or for the fetus. But because we don't have information, we would still recommend that conversation. If someone doesn't want to have that conversation, they feel very confident getting it, there's absolutely no reason not to get it. We would be supportive of that as well.
Thank you, Dr. Bohr. And we have a related question here. Beyond expectant mothers, how about individuals who have long-term chronic illnesses, such as high blood pressure, diabetes, or cholesterol? Is it safe for them to receive the vaccine?
It is absolutely safe for them to get the vaccine. It is absolutely recommended for them to get the vaccine because we know that those specific risk factors, high blood pressure, diabetes, obesity, those are the people who have those health conditions are the ones who are getting the most ill from COVID-19. They're the ones who are more likely to have severe outcomes and be in the hospital. So for them, definitely we would recommend getting the vaccine.
Thank you, Dr. Bora. Another question here, and thank you, these are excellent, keep them coming, is why some variants of coronavirus are more contagious and possibly spread more easily than others?
It's a great question. And something that people need to know is that, again, these viruses, they mutate. And it's not a surprise to us that this particular virus has done that. And there are probably been mutations that have developed over the past year that were less contagious. And the reality is we just didn't notice them all that much because they were less contagious. They kind of faded away on their own. So viruses do this. They are, they're, in as much as they're trying, because they're not thinking, they're just a bit of protein and genetics. But as they mutate and they find advantages to their own reproduction, those advantages are going to become more prevalent. And so it's kind of a good news, bad news. It's not a surprise that there are variations now that are more contagious. Generally speaking, as we look across history of infectious disease, we typically find that as viruses mutate, they often become more contagious, but they often also eventually become less virulent, less intense of symptoms, because it's not in the virus's best interest to hurt or to kill its host. So hopefully that will happen with mutations as we proceed as well. Hopefully it'll become less serious to us, even if it may become more contagious to us.
Excellent. Thank you, Dr. London. We have received several questions directly related to the vaccine, which I know Dr. Bora will be speaking about momentarily. So I will recommend that we hold off on answering those. And Dr. Bora, if you could call those to your attention in your remarks, that would be wonderful. Any other questions for our speakers related to novel coronavirus? All right, hearing none, we will keep things moving along and hand it back to Dr. Bora.
All right, so I'm going to talk just a little bit about what natural immunity is, and then talk just a quick overview about what vaccines are. So your natural immunity, so when the body is exposed to a germ, so like a bacteria or a virus or a parasite or a fungus, your body has a way to protect itself from infection called the immune system. So each germ is made up of a particle that's recognized by our body as something that's not supposed to be there. Once your body sees a germ that it hasn't seen before, it creates special proteins called antibodies, which are then able to destroy that germ. When the body sees a germ for the very first time, it takes some time for the immune system to learn how to make the antibodies it needs to protect itself. It's during that time period that people can get very sick. After the antibodies are made, your body also, this is really cool. I really like this part. Your body makes memory cells that remember how to make them. So these memory cells stay alive even after your body has gotten rid of the germ. So now, if you're exposed to that germ again, your immune system can start making these antibodies really quickly and prevent you from getting sick. So what vaccines are is vaccines are a way to teach your immune system how to make that special antibody protein that can help destroy a germ without actually letting that germ get into your body. So it's pretty amazing, this whole technology that developed vaccines. So some kinds of vaccines contain the same chemicals as the germ. So your body's immune system can learn to recognize these chemicals if the whole germ tries to get into your body, but they don't have the actual germ. So they don't make you sick because they don't have the actual virus, for example. Other kinds of vaccines can sneak into the cells wearing the same clothes as another harmless germ that can't make you sick. And that your body's immune system learns to recognize the chemicals that are hidden inside another germ's costume. So a person who has had the vaccine can't get the actual infection because the vaccine doesn't have the entire virus in it. But now the immune system can see that the parts of the germ that doesn't belong there, and it starts making antibodies. So it's kind of being tricked into thinking that the virus is there, but it's just a little piece of that actual virus. So now it's making these antibodies because it's getting ready to fight these germs that don't belong. And since now it's not a real virus, you can't get sick while your body is making antibodies. You might have some reactions from the vaccine, but that doesn't mean that you're sick or have an infection. So now that you're making these antibodies, you're also making these memory cells. So now if you're actually exposed to the real virus, and let's say the coronavirus, your body sees that, oh, I've seen this before. It starts making those antibodies really quickly. You don't have the delay where your body is trying to figure out how to attack. And so now your body is protected much more quickly, and that prevents you from actually getting sick from the actual virus. So once you've become vaccinated, so once I get the vaccine, I protect myself from getting sick with the virus, but I also reduce the chance that all the people around me are going to get the virus. So if I'm not coughing, I'm not sneezing because I don't have the infection, I can't get other people infected in the same way that I could if I actually had the coronavirus. So now I have a bubble around me that is also protected. I'm sure you've all heard of the term herd immunity that people have been talking about. And what that means is that the more people who are immunized, the fewer places the virus has to go to replicate. So as Dr. London was saying, this virus needs live beings. It needs somebody to be able to continue to reproduce. If all of us are vaccinated, or the majority of us are vaccinated, the virus has nowhere else to go. Herd immunity, the percent of people in a community that need to be vaccinated to reach herd immunity really depends on how contagious a specific virus is. So for example, measles is one of the most contagious viruses out there. To really protect the whole community, most everybody needs to get the measles vaccine. Coronavirus is contagious, but not quite as much so as the measles virus. So, but we also know that the variants that Dr. Linden spoke about, those are now becoming more contagious. So as time goes on, more and more people need to get immunized to be able to protect everyone. There will always be certain people who can't get the vaccine. So for example, right now, children can't get vaccinated. But if we can get most of the adults around these children vaccinated, we're protecting them as well. And that's what herd immunity means, that the fewer places the vaccine has to go, the more people will be protected, even if they may not have, even if they can't receive the vaccine for some reason or another. I'm not sure what, okay. I think, is Adam, are you on to the next question?
I think so. I think I've got the next few bullets here. So
okay.
This is all very important for us because we need to make sure that in order to achieve that community protection, that we have a high level of vaccination throughout the community. And that's especially concerning for us because there has been a history of abuse, and there are many traumas that parts of the community remember and have experienced that go back to many of these abuses. So, historically, when we think about how vaccines and other medical treatments were first experimented on children or on parts of the population that had less of a voice in centuries and decades bygone. We talk about how prisoners have been experimented on, whether they were prisoners of war or prisoners in correctional facilities in the past have been exposed to experimental drugs. And that has affected people's thinking about these things. And of course, the most recent, highest profile example is Tuskegee and the experiments that were done over the course of decades in the middle part of the 20th century related to syphilis, where the U.S. Public Health Service identified a population, African-American people in Alabama who had syphilis, who they were not transparent with. They told them that they had a quote, bad blood disease. And they offered them free medical care. But what they actually did was they wanted to test and see what happened with syphilis infection in a community if it was untreated over a long time, a longitudinal study of untreated syphilis in a population. Highly unethical on every count. And so those types of examples have colored the way that many people view medicine and public health and government agencies when we say now in the year 2021, different people and different agendas altogether. But when we say now that this is something that's going to help all of us, many people look at that with some skepticism. And it's honest, healthy skepticism because of the lived experience and the institutional memory that exists. And so we really need to continue to recognize that trauma and to heal from it and to build a pathway to a better future for everyone, because we will not get through this pandemic or any other major community wellness issue unless every part of our community gets through it together. And so that's really powerful. And we need to make sure that that we can realize the great potential that these vaccines have for getting us there. And vaccines, while there have been abuses in the past, vaccines have a tremendous record of safety and have been one of the greatest accomplishments of the past 100 years. I was recently, I took my daughter, she was I think 7 or 8 at the time, to a cemetery. And we were walking around and she was noticing all these little graves of children, months old, 1, 2, 3, 4, 5 years old, just little kids buried next to their parents. In many cases, they were so young they didn't even have a name. It was just baby, and they only lived for a few days or a few weeks. And she asked me, "Dad, why did all these little kids die?" Well, in most cases, they were dying of things that are now vaccine preventable. They were dying of measles and pertussis and mumps and rubella and so many other things that are now preventable. And so vaccines really are an astounding improvement over the way things were in the pre-vaccine era. Things like smallpox. We don't have smallpox as a problem anymore. It's been eradicated. Smallpox killed many millions of people and was one of the worst killers of humans ever. And it's eradicated because of vaccine. We don't have polio in this country, and polio is very rare around the world because of vaccine. So we have done tremendous things lengthening and improving the quality of life with vaccine. The return on investment for vaccine is just extraordinary, that every vaccine saves many, many dollars worth of loss to the community through loss of productivity, from medical cost. It's very, very expensive to treat someone from a severe disease that could be preventable with a very affordable vaccine. Now, there are reasons why some people have hesitancy for vaccines, some of which I explained earlier, that some people have this trauma about being abused in the past and about their parents, their grandparents having been abused by medicine in the past. And so those are real reasons for hesitancy. There are other reasons for hesitancy that are based on a lot of poor information. Many people have heard about concerns about autism. There is no evidence anywhere, no legitimate evidence that autism is linked to vaccine. In one case, there was a journal article back in right around the year 2000, I forget the exact year, that made a connection. It was later found out that researcher was falsifying and really cherry picking particular data to use for their story in order to make a connection so they could profit financially from that storyline. And so when we hear about some of these vaccine conspiracy things, we really just shake our head in disbelief, because it's truly and tragically unfortunate that some of these lies have been spread and that people make a profit off of spreading this fear about vaccine. Vaccines have a safety history that is unmatched. True vaccine injuries are incredibly rare. And the illness, the death, the injury that is prevented every year from vaccine is just extraordinary. So we of course, are very strong supporters of vaccine here at the Kent County Health Department, and we hope that all of our community, and especially you, can be champions for vaccine as well. And I'll stop there.
Thank you, Dr. London. And before we turn to questions, I want to give Dr. Bora an opportunity to respond to several of the questions that you raised in the earlier section. I've shared those with her via the chat, but again, they are: which company's vaccines are most available around West Michigan and in the Grand Rapids area? Should I wear a mask after 2 doses of the vaccine? And can a person transmit COVID-19 after being vaccinated? Will we have to get new COVID-19 vaccine? How frequently? Every year?
I know those are all really great questions. So right now there are 3 vaccines that are available in the country. Those are the same ones that are available here. The ones that are available are Pfizer and Moderna. And as of this week, we have just received the Johnson & Johnson vaccine, which is a 3rd type of vaccine. Should I wear a mask after? Yes, you should continue to wear a mask after your 2 doses of vaccine. We are still learning more about the variant. And we just want to, if you're around people who have been vaccinated or around in your family circle, it's okay not to wear a mask. But I will share that the CDC guidance that I shared really goes through carefully what people who've been vaccinated, when they should wear a mask and when then they can not wear a mask as well. So can a person transmit COVID-19 after vaccination? So this is a really good question. I think we don't have a great answer yet. Our assumption, the data does not have clear information about that at this point. There is still a chance that people who've been vaccinated can spread COVID-19 and be asymptomatic. It's not likely that there's a chance it's going to happen, but most vaccines, though, once people have been vaccinated, they cannot spread that vaccine without symptoms. So we should get more information soon from the data to find out if we can transmit asymptomatically. At this point, we should probably act under the assumption that we can, and that's why we recommend wearing a mask. But I think we'll learn more soon. And then will we have to get a new COVID-19 vaccine? We don't have the answer to that either. I think with how quickly the virus is mutating and the variants that are coming out, I think it's likely that we may need a repeat vaccine once a year, like the flu vaccine. We don't have the information yet, and hopefully we'll find out as time goes on what needs to happen there.
Thank you, Dr. Bora. And we do have a couple additional questions here about comparing antibodies from those who have already contracted coronavirus versus those who receive the vaccine. So pros and cons, it sounds like, of contracting the virus versus receiving the vaccine. And a question about children. Many people curious about when children will be able to be vaccinated.
So those who have had COVID should absolutely get the vaccine as well. We don't know how long protection lasts from the natural infection. And with the variants as well, we don't know exactly, is the infection that they had with COVID before, will that still be protective for a new variant that they may be exposed to? So at this point, yes, anybody who's had COVID should get the COVID vaccine. It's important to not get the vaccine while you're still contagious. So don't go in the first 10 days after you get COVID. Wait until you start feeling better and you're not going to infect anyone else, but then you don't have to wait. You don't have to wait 90 days. You can just go ahead and get registered for the vaccine. And then children, I know my understanding is that children as young as 12 are being included in the studies right now. So we should have more information about the 12 and up population somewhat soon, but younger children, I don't know when that will be. Adam, do you have any more information about vaccines in children, when that will be available?
I don't. Of course, the standard for approving vaccines in children, it's just a different bar because their body sizes and everything are so very different. And of course, we don't want to expose them to anything where we're not really confident. But there's no reason that I've heard that anyone has a real concern that the vaccine will be harmful to children. It probably works just as effectively with children. They just want to be extremely protective of that recommendation before they issue it.
Thank you, Drs. Bora and London. Before we turn to novel coronavirus vaccine in more depth, I do want to open questions up for vaccination in general. And I'd ask in particular if participants in today's training have any questions about how to communicate about vaccination to members of your community. So again, understanding that many of you will be taking this training to others and doing outreach with members of your community, any questions about how to communicate about vaccines and vaccination to members of your communities?
Hi everyone, I have a question. I have to leave pretty soon, so I'm just gonna ask this question. Cherry Health reached out to our community member about Johnson & Johnson thought trial, and they said like it would be under strict supervision of doctors. The participant who are interested has to see doctors, I think once a day or once a week if they choose to participate. So is Johnson & Johnson ready to go, or they're still in trial?
Johnson & Johnson is ready to go. It's been approved for use. It's available. This trial they're looking at is for, I believe, a 2-dose regimen. So Cherry Health has been participating in the Johnson & Johnson trials from the beginning. We're actually really fortunate to have a site right here that's been part of that larger international study. So it is approved. It is ready to go with the one dose. They're studying a new formulation of that vaccine.
Thank you.
Thank you, Dilly. Other questions for Drs. Bora and London about vaccination? Again, we would welcome folks to continue submitting those via the chat, but hearing none, we will continue with novel coronavirus vaccination.
All right, so as I mentioned, there are currently 3 vaccines that are available for coronavirus. So one is the one that you've heard of, the mRNA vaccines, which is the Moderna and Pfizer vaccines. So how these vaccines work is that they have a little recipe that's surrounded by a coating of fat. So that recipe is once it's injected into your body, that little recipe surrounded by fat goes into your cells. That fat is what allows that little particle to be taken into your cells. Once it's inside your cell, that little recipe gets translated into a protein. Your body starts using that recipe and it reads that recipe and it makes tons of protein. And that protein is a little spiky part on the coronavirus. Once it's made inside your cells, your cell says, this something is not right. This is not supposed to be here. It sticks it on the top of its cell. And now your immune system is like, oh, this is not right. There is a foreign thing in here that's a germ. It's not supposed to be here. And it goes into action. It does what it's supposed to do. It starts making those antibodies. It starts making those memory cells. So in the future, once you're exposed to coronavirus, if you are exposed to coronavirus, it can ramp up really quickly and get those antibodies into gear. So it's kind of like an email recipe for your immune system. Once it teaches your immune system how to make those special antibodies, that email is deleted. That little mRNA recipe from your cell, it lasts 1 or 2 days. It's not very stable and it's gone. This is why we don't feel that there are long-term side effects from the mRNA vaccines. Even though this is new, this type of way of making vaccine hasn't been done before, but the way that it's done is very safe. The little recipe that's not actually even a piece of the virus. And so there's no way that the actual virus can get inside you and replicate. So you can't get sick from the coronavirus. It gives you a much safer way of learning how to protect yourself than actually getting coronavirus. So it's really an exciting new technology that's also very effective, 94 to 95% effective in preventing moderate to severe COVID illness. So it's wonderful. The new other sorry, it's been a long day already. The other vaccine that's out is the Johnson & Johnson vaccine. So this is what's called an adenovirus vector. So the adenovirus is a virus that causes the typical common cold. This is actually a very standard way that vaccines are made. It has been used for a really long time. So what it does is it takes a piece of this cold virus, the adenovirus, and it inactivates it. So it's now dead. It can't actually replicate. It can't do anything once it's inside your body. What they do though, is they make this virus, they give this virus, the adenovirus, a little piece of the DNA a piece of the genetic code from the coronavirus. So now that it's in there, it gets inside your cell, and now your cell starts making the coronavirus spike protein. And it's using this cold virus as the way to learn how to do it. So now your cells are making this little spike protein, just like from the Moderna and Pfizer vaccines. And then it does the same thing. It presents it to the outside of your cell and it gets your immune system ready to go. And it starts ramping up your antibody production. So they ultimately both have the exact same impact on your body. They're just done in slightly different ways. Some of the differences between the Moderna and Pfizer vaccine and the Johnson & Johnson are some of the side effects that you would get after getting the vaccine. Because the mRNA, that little recipe piece, the little fat that surrounds that recipe, your body can react to that. So people get achiness in the arm. They feel like they may have fever or chills or body aches. And that's reacting to the fat that is being injected to get that little piece of mRNA into that cell. The Johnson & Johnson vaccine, people don't tend to have quite as many reactions to that specific vaccine. So again, the thought there is not really a clear biological way that these would cause any long-term side effects. Just as with other vaccines, people get them throughout childhood. These vaccines are not linked to any kind of serious long-term side effect. The main issue, again, is just the symptoms that people may get for the first couple of days, usually 1 to 3 days after getting that initial vaccine. The difference between the Johnson & Johnson and the mRNA one, again, is that the Johnson & Johnson is just 1 dose. You get that 1 dose, and then you get the full immunity from that 1 dose 2 weeks later. With the other two vaccines, it's a 2-dose series. So you get 1 dose, and then the second dose is 3 or 4 weeks later, and then full immunity happens after that. So 1 to 2 weeks after that second dose. So it takes a lot longer for your body to have the full protection that it needs from the vaccine. There have been lots of questions about efficacy. How helpful is this vaccine in preventing illness? So with the Moderna vaccine, it's about 94.1%. So, very effective in preventing any kind of symptom, having coronavirus with any symptoms. Same thing for Pfizer. With Johnson & Johnson, this study was done at a very different time period and in different places compared to the Moderna and Pfizer vaccines. It was done later in the course of the pandemic, so there was a lot more virus circulating in the community. It was done in South Africa, in Latin America, and the US. And so, as Dr. London mentioned earlier, there are variants that took place that started off in South Africa, in Brazil. And so these are areas that were where this new Johnson & Johnson vaccine was being studied. And so it's really hard to compare how well one vaccine worked when it was done with a healthier population where there were no variants, looking at a different type of vaccine that was studied at a very different group in a different time frame. But still, that's important information to know when we think about how effective these vaccines are in preventing illness. So the Johnson & Johnson vaccine in the United States, it was 85% effective in preventing severe illness. So that means if I get the Johnson & Johnson vaccine, I have 85% less chance of getting sick than someone who got no vaccine. So again, a very effective vaccine. The CDC looks at any vaccine that's more than 50% effective in reducing illness as something that would be considered being used. And that means if it's more than 50%, it's going to be effective in helping end the pandemic. And so that's the reason that all of these vaccines have met the CDC standards for really being really helpful in reducing the impact of this pandemic. And for comparison, the typical flu vaccine is about 50% effective. So all of these are by far much more effective than the flu vaccine. The other thing with the Johnson & Johnson vaccine is that it was 100% effective in preventing hospitalization and death. So out of the entire trial, everyone who got it, nobody who received the Johnson & Johnson vaccine was hospitalized or died. And so those, again, are really huge results that are very exciting and really having a safe vaccine to end this pandemic. One last thing about the Johnson & Johnson that is exciting to me is that it actually tends to improve over time. So looking at 6 weeks out compared to right after if you compare 2 weeks after the vaccine to 6 weeks out, at 6 weeks out, it was 90% effective. So as time goes on, their body's immune system becomes more and more effective from that initial dose.
A lot of points. Just a couple of points on this slide. The testing and approval process that the FDA has is incredibly rigorous. In fact, the FDA is known as having the world's gold standard in testing and approval process. They are, I think, by far the most rigorous process anywhere. In fact, a lot of countries don't even have an equivalent of the FDA. They just rely upon the US FDA as their decision point for whether or not to allow it in their nations or not. A lot of other countries that do have a process, I'm thinking of Russia and China, which were very quick to approve vaccines, have a far less rigorous approach. When a vaccine candidate like these is reviewed, there are a series of trials that go through. Each trial is a little bit larger and a little bit more inclusive of the overall population, so that when we get through we call the phase 3 human clinical trial, those usually include tens of thousands of people, even more so for these because there was such an urgency in gathering data and bringing that data to the FDA for review. So the FDA has reviewed the data for these 3 vaccines, has issued an authorization for their use, that they still are being tested in the sense that we would like to know more about the lasting immune response that they foster over time. So scientists are continuing to watch the population to see how lasting the immunity resulting from the vaccinations is. And the safety so far has been tremendous, as Dr. Bora mentioned, that there have been very few reactions, and when there have been reactions, they've been fairly mild. Can I choose the vaccine that I'm getting? Not at this time. People can't choose the vaccine. And oftentimes when they schedule an appointment with us, we don't often know what vaccine product is going to be available for that appointment. It could be the Pfizer, it could be Moderna, it could be Johnson & Johnson. We do recognize and respect that some people have a strong preference for or against one or more of those vaccines. Unfortunately, right now, we can't tell them what vaccine will be available to them until their actual appointment. And if someone at that time wants to decline because they don't like that vaccine that's available to them, they have that right. They have a right to know before the injection happens what vaccine product it is. And they could refuse vaccine at that time. And we would do what we could to make an alternative available if possible. And if not, they would just need to wait until a vaccine of their choosing is available. But, you know, we really want to encourage people to take the first vaccine that is available to them. All these vaccines are highly effective. And so we really want to encourage people that unless they have some other reason that is important to them, they really should just take the vaccine that's available. Mask wearing and social distancing are part of the vaccination strategy. As Dr. Bora mentioned, we still are going to recommend after you receive your vaccine that you continue to wear a facial covering, that you continue to do social distancing and hand sanitation and all that. Because while we know that these vaccines are great at reducing or preventing illness, we don't have a good conclusion yet as to whether or not they can prevent actual infection or not. So it may be that while they're preventing you from getting sick, you could possibly be infected, possibly spreading it to others asymptomatically. We just don't know about that yet. So until we know one way or the other on that question, we're going to continue to recommend that you wear a facial covering, social distance, and it's consistent with the hygiene. Can expand my pod to include other vaccinated people. Got to be careful. For all those reasons, you need to be careful because the vaccine is not 100%. No vaccine is 100% effective. So there will always be a small portion of the population that just didn't react, they didn't respond with an immune response to that vaccine. They may still be vulnerable, and we could still be spreading it asymptomatically amongst ourselves. So according to the governor's latest epidemic order, actually the director of the State Department of Health and Human Services epidemic order, we can have gatherings of up to 15 people from up to 3 different households inside in a house. Although I would really say that's a maximum. I would try to keep it as low as possible and just be careful. If you're vaccinated, yes, we're going to start to open up some freedoms and encourage people to start to loosen up a bit. But right now, we really want people to maintain discipline for a little while longer so we can get everyone vaccinated. And I think we've addressed the can children be vaccinated question. So any questions about any of these points?
Thank you, Dr. Sporer in London. We do have 2 questions about the vaccines from different companies. One question about the recipes and whether pharmaceutical companies are expected or anticipated to share their recipes with other companies in order to ramp up production. Another question about mixing and matching vaccines from separate companies for an individual.
Yeah, and so when it comes to production, we had great news this past week when the drug company Merck agreed and is now going to help Johnson & Johnson produce that vaccine. And these are 2 big competitors. And so to have them coming together for vaccine production is really amazing. And I expect that we may see more of that as we proceed. At one point, there were over 100 companies around the world trying to create a vaccine. Now that we've got a growing handful of effective vaccines, it's not going to make sense for there to be 100 different vaccines on the market. It's going to make sense for these companies to contract with one another to help make some of these approved vaccines. And no, you should not be mixing and matching vaccines. If you received a first dose of Pfizer, you need to receive a second dose of Pfizer, and the same is true with Moderna.
If there are some extenuating circumstances, it can be done, but not ideal. And same with Johnson & Johnson. If you receive one dose of the mRNA vaccine, the Pfizer, Moderna, and for some reason you just cannot get the second one, in some circumstances you could use Johnson & Johnson for that second one. But again, not what should be done typically, but just under abnormal circumstances.
Great. We have one more question about why there are 2 doses for the Moderna and Pfizer and not just one. And then another question about the mass vaccination rollout. Where are we in the phases of the rollout? Who other than people age 65 and older can receive the vaccine?
So who's available for the vaccine? So right now, as of today, anyone who is older than the age of 50 or older with underlying health conditions, someone who is a food production worker, those are all people that can be eligible for the vaccine, along with those who already have been eligible along the phase 1A and those from 1B, such as teachers and law enforcement and child care workers, all of those. And as for the 2-dose and 1-dose, Dr. London, jump in here, but I think that's how they were studied and that's how they were made. The Moderna and Pfizer mRNA vaccines were a new technology. I think they wanted to make sure that so some people don't always respond to the first dose. And sometimes the first dose will give your immune system a chance to start recognizing these antibodies, but the second dose acts as a booster and it gives your body, either those who haven't responded will respond the second time, or those who have responded, it gives your immune system another chance to recognize that foreign germ and build up the immune system again. The Johnson & Johnson, actually that is a study that Dilly referred to earlier. They are studying Johnson & Johnson for a 2-dose series to see if it can increase its efficacy with the circulating variants. But I don't know why they chose 2 doses for one and 1 dose for the other.
Yeah, that's exactly my understanding as well, that with the Pfizer and Moderna being a new technology, they tested it based on those 2 doses. Although there is some growing body literature that says for most people, there is a pretty significant immune response after just the first dose. Now we want people to get both doses to be fully assured of a high level of effective protection, but that's really just the way they were tested. The Johnson & Johnson being the adenovirus-based vaccine, there's lots of experience with that type of vaccine, and so there was a lot of comfort in going with clinical trials with a 1-dose regimen.
And knowing that it's, if this is a vaccine that's available for the entire world, there are many parts of the world where it's going to be really difficult to get 2 doses in people. Even in this country, it's hard to get people back for a second dose. So if you think about rural areas and countries without reliable transportation, healthcare infrastructure, I think that there's a huge benefit to having a 1-dose regimen that can be refrigerated. And that's the other huge difference with Johnson & Johnson is it doesn't need to be stored in an ultra cold freezer, which is huge and life-changing for many people across the world.
Drs. Bora and London, we've had many questions from the community about participating in the vaccine rollout. For those who have been concerned about refrigeration requirements with the earlier vaccines, is there another opportunity for them to engage with you folks in distributing the newer vaccines with less stringent refrigeration requirements?
Absolutely. With Johnson & Johnson, I think it'll be much easier for primary care offices to be able to give vaccine directly from their offices. The challenge is that once you open a vial, you have 6 hours to use it, and that's 5 doses. So we want to make sure that we don't waste any doses of vaccine. So as long as offices are able to use that would be a great option for them. And there's also a rule that any healthcare provider that wants to give a COVID vaccine has to be registered as a COVID vaccine provider with the state of Michigan, or it's the CDC. I can't remember exactly, but there needs to be a registration process and you have to be approved. And so it's not a long process, but it still is a step that needs to be taken. So yeah, I think definitely this will help roll out for sure.
And we certainly see that right now we're in this mass vaccination phase where the president has said that by the end of May, there'll be enough vaccine for every American to receive a dose. That kind of massive rollout really requires a mass vaccine strategy where, we're using a lot of different venues to do that, including the West Michigan Vaccine Clinic at Boss Place. But long term, and as we get into the summer, we're not going to have these same clinics operating in perpetuity. The long-term vision is that it's going to be at your doctor's office, at a pharmacy, the same way that other vaccines are made available, like the flu shot. And I expect that hopefully by the time we're in summer and from that point forward, you'll be able to get a COVID vaccine at all of those regular stops.
Great. Thank you, Drs. London and Bora. At this time, again, we'd like to open it up for questions. And again, any questions for improved understanding, any questions to help you communicate this with members of your community, and any myths that you would like to hear busted. What are you hearing, and how are you hearing people communicate about the vaccine that you would like to know whether or not it's true?
There's one that I've heard a lot about it affecting fertility. And actually, the American College of Obstetrics and Gynecology has stated that this is a safe vaccine for anyone who is thinking about getting pregnant in the future. There's been no evidence that it affects fertility. Actually, women have become pregnant while in the study trials for these vaccines. So I just wanted to put that out there. It's a question I've received a lot.
Thank you, Dr. Bora. Any additional questions for Drs. Bora or London about the coronavirus vaccines?
Yeah, I have a question kind of regarding the Mythbuster, or I guess, and this is Stacy Willis talking, sorry. I often hear, so many people always say, well, the vaccine was rushed, or how was it created so fast, and those type of things, Had the vaccine been, been in development before, last year, or is it truly just, just took a year to kind of get here, or kind of how to explain that to people?
Yeah, it's a great question. And to that point, it usually takes many, many years to develop a vaccine, especially against a virus that we don't have other existing vaccines for similar types of viruses. In the case, I think there are two things that made this possible. One is that COVID-19 became a priority for the entire world. And so science and industry around the world was focused on solving this problem and bringing this vaccine to production in probably a way that the world has never been united on ever. And so I think that united scientific battlefront to find a vaccine really helped. And the information sharing that was happening between research labs was tremendous. The other thing that gave us, I think, a little bit of a head start is there have been a couple of other coronavirus epidemics or crises of the past 20 years. One was SARS, and the other was MERS. And both of those were scary enough to enough researchers that we really studied those things very carefully. And some research had already started trying to develop vaccine for SARS in particular, because that one was very, very dangerous. Fortunately, it wasn't very contagious. But because of that existing research, I think that kickstarted a lot of the research for this particular virus.
Thank you, Dr. London. Dr. Bora, we have a question related to fertility with expectant women and also brain damage. Anything you can say about those assertions?
No, I haven't heard about the brain activity one. But just thinking about, again, how it works, I don't see how it could do that. And honestly, I think when I think about it for myself and for my family, I compare it. Would I rather have a vaccine that gives me part of the coronavirus and allows my body to develop the protection it needs, or would I rather have coronavirus? And we know that people who get coronavirus, they can likely, it can affect their fertility. It can affect their heart. It can affect their brain. It can affect their lungs. We see people with symptoms from COVID for months. We have people who can't taste for a very long time. People die. And so I guess it's hard to so no, I don't think there's truth to either of those, brain activity or to fertility. However, I think in making a decision that you feel is best for yourself and for your family, I think for me, that's the comparison that helps me explain it to my family well, to say, would I rather have this vaccine where there's, the way that it works is unlikely to have long-term effects. I might get sore for a couple of days, or would I rather have the actual coronavirus? Because we know that that's circulating and could be likely in the future.
As we entertain some more questions here, I just want to remind everyone to tend to your needs. If you need to use the restroom, grab a snack, please do so. But I'd like to check in just briefly with everyone. If you look at the bottom of your screen, you have several options, including a thumbs up option. If you would like to continue through our formal break to allow more time for Q&A, just go ahead and give us a thumbs up and let us know. If you don't want to continue and do want to take a formal break, do nothing at all right now. So again, if you'd like to continue with questions through the formal break, please go ahead and give a thumbs up at this time and we'll weigh in. Okay. Why don't we go ahead and entertain a few more questions before we move to the next formal presentation of information by Teresa. That way, those folks who do want to take a several-minute break have the opportunity to do so. Those who wish to hang on and continue with questions are able to do that as well. We have a couple questions here. Thank you, Dr. Bora, for answering Chris's question about side effects from the vaccine being less severe in older adult populations. That is consistent with what Dr. Bora has been hearing. We have a question from Brittany here. Do you think if the same amount of people who usually get the flu shot got the COVID shot, that would be enough people to make it so things could safely open back up again, or more people have to get it because it's new?
Well, sadly, not nearly enough people get the flu shot. And I don't have the percentage in front of me, but I think it's only like 30%, about a third of people get the flu shot every year. And in order to achieve that population level immunity with COVID, we need to be above 70% and probably closer to 80 or 90%. So we need more people.
Great questions, everyone. Any other questions for Dr. London or Dr. Bora? We have a question from Nicole. Some in the community have asked if they have the choice of not receiving the Johnson & Johnson vaccines for religious reasons. Could you speak to that, please?
Yeah, certainly they have the choice. And that's where, as I mentioned earlier, it's everyone's right to know before the injection happens what that product is. And if at that time they want to decline because they have a religious objection to that particular vaccine, they can do that. If it's possible, and it probably won't be, at least for a while, if it's possible for us to arrange an alternate, we would do that, but we can't guarantee that. And so we might have to reschedule that appointment for a different time.
It may be difficult. I don't know that when someone is actually scheduling their appointment, we may not know at that time. There's a good chance we will not know at that time which vaccine they will be offered when they come in. So that information is something they may find out when they walk in for that appointment. I know that can be frustrating, but I don't know that logistically there's a better way to do that at this point, because we find out on Friday what vaccine we're going to get on Monday and how much. It's hard for us to plan that in advance.
Great. And we have a question about when the vaccine will be available to everyone.
Well, I hope it's very soon. I hope it's very, very soon. We can deliver as much vaccine as the state sends us every week. And that's why it's so important to us that we have large-scale mass vaccination sites with partnerships with the hospital so we can roll out all that vaccine all the time. The president has recently said that based on what he's hearing from the producers at Pfizer, Moderna, Johnson & Johnson, Merck, that by the end of May, we ought to be able to have enough vaccine to offer everyone a dose. That seems pretty ambitious, but I've got a lot of confidence and optimism that that can be done. And that's how we're planning, that's how we're moving forward. So I would expect that over the course of the next few weeks, we're gonna see more of these phases and more groups open up. So please just pay attention to that, and please keep watching vaccinatewestmi.com, and we'll be sharing information about who's eligible there on an ongoing basis.
So do you want to address the other question that San has in the chat, asking about Asian people are concerned about different genetic questions, and would the Western vaccine be still effective for those of Asian descent? And the answer, they really worked hard at all of these trials to ensure that they had a diverse group of people who are in all these study trials. I'd have to look at the actual report to look at what percentage, but they worked very hard to make sure that it wasn't just one group of people who were being studied in these trials. It was all different races and ethnicities and ages, to make sure, it was for that very question, to make sure that the vaccine efficacy was looked at for all different groups of people. So we're not concerned. Looking at the data, we're not concerned that these would have different impacts on different racial ethnic groups.
Great. I'd just like to thank our speakers again for some really helpful information, and use this as an opportunity to shift gears to Teresa Branson, who's going to be speaking about some tools and tricks for equipping you to have this conversation with other members of your community. Teresa?
Thank you, Justin, and thank you, Dr. London and Dr. Bora. Justin, are you able to bring up the Vaccinate West Michigan site resource page?
Yes, will do.
Okay. And then to the next, well, Next slide, if you can, while you're waiting. So one of the things we wanted to end with, and we have about 10 minutes and we want to respect everyone's time, is we have been developing a number of resources. Some of these you have seen, and we continually want to drive people to the Vaccinate West Michigan website. There's a tab labeled resources. And within this tab, we just continually want to ask each of you to share this website with constituents, family members, friends, neighbors, colleagues, and really to utilize this as a resource. So the FAQ is continually changing as we learn more. But you can see here at the top of the page, there's this resource tab. And on here, many of the things that were discussed today, many of the questions in the presentation were designed after the frequently asked questions that we're receiving throughout the community and that each of you receive as well. So we are developing a number of items. So we have the frequently asked questions is a great resource, and the frequently asked questions, I believe also are available, I think at a minimum in Spanish currently. Let me throw my glasses on here. So we have on the Vaccinate West Michigan site, we have the FAQs in multiple languages. We're also working with our marketing communications manager to develop videos. So we have 2 or 3 videos that have been complete on FAQs, starting with those that were in American Sign Language. In addition to that, we're taking the presentation that was developed today. We'll break that down into video segments so you can share the training as a resource tool and to utilize as you see fit. We also have important fact sheets and handouts down at the bottom. And this is just a 2-pager. We'll send this as a follow-up. And this is in the process of being updated. This was a document that had our commitment as public health leaders to get vaccinated. One of the next things we're going to be working on is taking the same 2-page Vaccinate document and inviting community leaders to share their commitment to get vaccinated as well. We recognize that our community has different trusted public health messengers, so it's going to become increasingly important that our community hears and sees from different individuals that represent different population groups in their commitment to getting vaccinated. Asking that individuals continually seek assistance from the health department, looking to see what we can do to be a resource to you. We've heard very early on that our community really wanted one source where they could receive information. Doesn't mean the messengers can't change, but the Vaccinate West Michigan website is our one source that the health department, each of our health systems, Cherry Health, multiple community-based organizations are referring to for everything COVID-19 and everything related to COVID-19 vaccines. So this site can be changing frequently, and we just ask that you continue to look to this site. The resources are being stood up for our residents and for each of you. We're working on testimonial videos. This is something we're working on locally. It's something that's going on at the state. So you'll also see helpful links on this site that takes you to CDC, as well as Michigan Department of Health and Human Services resources and tools. So just think about this, our Vaccinate West Michigan, as a kind of a one-stop for anything COVID-19, anything related to vaccines, and more to come. So I want to stop there, and also encouraging people to utilize the email address we stood up to send questions. That is really another source of how we learn what people's questions are as we receive questions to the COVID-19 email address, which I'll repeat that for the chat. Sorry. It's covid@kentcountymi.gov. Please continue to send questions there. We utilize those questions to help build up our FAQ. So we're at 1:24, so I'm going to stop there and just ask if anybody has questions on the resources that are listed on our Vaccinate West Michigan site, resources that you think would be helpful to you in your work, and also just, again, expressing our appreciation to each of you for the work that you're doing and to be another public health voice in the community. Thank you.
Thank you, Teresa. At this point, again, we'd like to open it up to all of you in the next 6 minutes or so to just discuss how you intend to apply today's information in the course of your everyday work. How do you envision using the resources that you've just seen in your ongoing efforts in the community? And with whom do you anticipate conducting additional trainings to ensure that these resources are available to all those with whom you work?
Justin, I think some, have, because we've been partnering with people throughout, I think many are utilizing, this website and resources as well, in addition to ongoing regular meetings and touch base. But I think, this portion of the training also, because we're recording it, many things that we are asked and many things that people request oftentimes are already out there, but I know that it can be a lot of information for our communities. So didn't want to spend a whole lot of time here, but wanted to make sure people know where to go when they access that website and what's all there.
Excellent. Thank you, Teresa. And I would just remind folks that you did receive a link to the website via the chat box, via email, and in all of the materials that were sent via email before this session. So please do check that out. If you do have thoughts or questions after today's training, particularly about how to conduct a similar training with your own community, again, please do reach out to covid@kentcountymichigan.gov. Again, covid@kentcountymichigan.gov. And the team there will be happy to connect you with someone who can help assist with that question. And at this time, if there are no other questions, we would just like to thank everyone again for participating today. Encourage you to reach back out if there are any other questions you do have. And please enjoy your day. We really appreciate you taking the time to connect.
Thank you, everyone.